The sleeve gastrectomy is the most common type of bariatric surgical procedure that we do for children and adolescents. It is a minimally invasive surgery that means that we make very small incisions and use instruments inside the abdomen. The operation helps patients lose weight by dramatically reducing appetite and by promoting a feeling of fullness soon after a meal starts. Using this laparoscopic or minimally invasive technique, a surgeon like me, alongside a team of other specialists, removes about 75% of the stomach. By doing this, the amount of food it takes to feel full is dramatically reduced. In this operation, we are removing the area of the stomach where a major hunger hormone is produced, and we are also changing other brain-gut signaling that reduces the desire for food intake. This is the underlying reason why surgery is typically so effective. To finish the procedure, surgeons use a surgical stapler to insert titanium staples to close the stomach. The portion of the stomach that is closed off is removed through tiny incisions that we make through the belly button, and these tiny incisions are then closed. This procedure does not affect digestion. Food passes through the digestive tract just as it did before, allowing it to be fully absorbed by the body. Like with all surgical procedures, there are small risks for bleeding and infections. Rarely, a leak can occur where the stomach has been stapled. When this happens, partially digested food and digestive juices can leak into the abdominal cavity, leading to an infection that could be severe. These infections occur in fewer than 1% of the patients and are treatable and reversible. There can be other complications that require additional visits or hospitalizations as well. Typically, young patients who undergo bariatric surgery stay just one night in the hospital for monitoring before they go home. There can be some discomfort expected following the procedure, but it is typically easy to manage. Most patients go home using only over-the-counter pain medications such as acetaminophen, which is more commonly known as Tylenol. After surgery, weight loss will initially be very rapid, approximately 5 pounds or more per week. It is very important to start vitamin and calcium supplements right away and to take them every day. It's also important to focus on healthy eating and getting sufficient fluids and protein every day. While long-term studies show that most young patients who undergo bariatric surgery keep the weight that they lose off, some patients don't do as well as others following the procedure. About 15% of surgery patients either don't lose as much weight as is considered typical or regain it quickly. We don't yet know all the reasons why some do better than others, but we believe that those who can adopt all the recommended eating habits and who are physically active each day will do the very best. Choices that patients make are thought to play a large part in how successful the weight loss is. If a patient chooses regularly to eat more than their body needs, they can gain the weight back quickly. Avoiding situations and managing feelings that may lead to overeating is one discussion patients will have with our dietitian and others on the team many times before and after undergoing the procedure.